Okay, everyone, why don't we get started? My name is Marc Kowalsky. I'm one of the orthopedic surgeons at ONS, and I want to welcome you to this edition of our webinar series. Tonight, I'm going to be talking about aging and exercise and exploring whether physical fitness can be a fountain of youth. Stay tuned till the end of the talk. We'll certainly take some questions at the end. If you look in your Zoom window, there's a question and answer function, and you can type your questions there, and I'll look out for them when the talk is finished. So Thomas Bailey Aldrich, the poet and former editor of The Atlantic, stated it well when he said, "To keep the heart unwrinkled, to be hopeful, kindly, cheerful, and reverent, that is to triumph over old age." And that's the charge of tonight's talk, to figure out how to triumph over old age. There's a misconception about aging, and this is based on the observation that is often described that a disproportionate amount of healthcare services are used by older people. And unfortunately, this tends to characterize older people as a societal and economic burden. And therefore, many conclude that advanced age must be synonymous with poor health, but I'm here to disprove that. With increasing frequency in my office, I'm interacting with patients in their 80s and 90s that are fit, active, and in fact healthy. Now, the concept of aging well refers to the ability to lead a healthy, socially inclusive lifestyle relatively free from illness or disability. Aging well also refers to being physically active with some sort of structured exercise program and also following good nutritional practice. And the goal with aging well is to enhance your lifespan and your health span both. It's clearly a fact that older people can in fact remain capable of making significant social, economic, and cultural contributions to society. Now, the first half of the talk this evening is going to discuss the importance of physical activity and its power in mitigating illnesses and disability. And the second half of the talk is going to focus on specific steps that you can take in order to execute a plan to be physically active in your day-to-day life. The challenge of aging well and expanding your health span really begins with a variety of lifestyle choices, however, not just physical activity. How much and what kind of alcohol intake and whether one uses nicotine are exceedingly important, and diet is also an incredibly important factor. Obviously, from our very youngest age, we're taught to maintain a well-balanced diet, and it is as important to us as we age. We actually need a certain amount of protein, carbohydrates, and fat in our daily diet. We need about 1/3 of our calories from fat, but we want to make sure that they come from the healthy fats or the unsaturated fats, from seeds and nuts and avocados, for example. We also want to be very thoughtful about the beverages that we consume. Many of the drinks that we consume on a day-to-day basis, like sodas and sports and nutrition and energy drinks, have a significant amount of sugar, and we really want to minimize these types of beverages in our day-to-day diet. But as James Fries well stated when he was professor at Stanford University, if you had to pick one thing, one single thing that came close to the fountain of youth, then it would have to be exercise. And when you look at the body of medical research from decade to decade, you see an exponential rise in the amount of attention being paid to investigations examining the impact of physical activity on overall health. On the other hand, when you look at trends as we age, the amount of physical activity we incorporate in our day-to-day lives goes down precipitously through the decades. In an average older person, older than 60 years of age, only 40% are getting enough physical activity, and that number goes down even further in our patients older than the age of 70, and that really is the importance of this talk. The other aspect that makes this so important is the fastest growing demographic in our older patients are those patients older than the age of 85, and for those patients, maintaining an active lifestyle is even more important. The reason why it's so important is the pathway from pathology to disability is a precipitous one. Pathology refers to diseases or conditions that we develop over the years. These conditions and diseases very quickly lead to impairment, which then limit our functional status day to day, which then imparts a disability as we try to navigate our daily lives. And we want to try to arrest this disability pathway as best we can. There are a variety of age-related changes that we need to keep in mind. Many of these are reversible. Sarcopenia refers to loss of muscle mass, and we'll talk a lot more about this later on in the discussion. Predictably, over time, we also see a decline in our aerobic capacity and a decline in our energy expenditure. We, of course, develop certain chronic medical conditions of our heart, our lungs, and other organ systems. Older patients can also notice impaired balance and agility and loss of mobility, which can, again, impart disability as we navigate our day-to-day lives. And from a neurological point of view and a mental health point of view, many of our older patients develop depression and memory loss as well. We want to try to forestall as many of these as we can, and physical activity is a great way to do that. In terms of some definitions before we go any further, physical activity is defined as a planned, structured, repetitive set of activities with the objective of improving and maintaining physical fitness. Similarly, exercise is defined as planned, structured, and strenuous and repetitive physical activity. And health-related exercise has the specific goal of improving muscular fitness and overall well-being. And this contrasts to performance-related exercise, which is more relevant for the competitive athletes that we treat in our office. The goals with health-related exercise are altogether different, and that's why this plan has to be executed differently in order to stay safe and injury-free. We grade physical activity on a spectrum. We have our inactive patients and we have our highly active patients. And each one of these is classified based on the level of intensity. Inactive patients maintain only a baseline level of activity, and this is relatively unhealthy. Patients that have a low level of physical activity might participate in less than 150 minutes per week of activity, and there's only a slight health benefit to this lifestyle. What we're really shooting for is minimum intensity physical activity where we participate in at least 150 minutes per week of physical activity, and this has substantial health benefits, as I'll demonstrate in the discussion tonight. So what are these health benefits? I'm going to go through many of these, and basically every organ system benefits in some way from a moderate level of physical activity. When we look at all-cause mortality in patients older than 60 years, the risk of all-cause mortality decreases by fitness level, and it's a spectrum. Even a little bit of physical fitness matters, but a moderate intensity will have a more profound impact. When you focus on patients older than the age of 80, their death rate among our high fitness 80-year-olds is actually less than the minimally fit patient who's in their 60s. So the impact can be profound in these older patients. And this association persists even after we correct for body weight. Cardiovascular disease is also positively impacted by physical activity, and basically every dimension of cardiovascular disease sees an impact. Whether we're talking about hypertension, survival in years, decreased death rate from cardiovascular disease, decreased events like heart attacks in asymptomatic men, and decreased sudden cardiac death in women. All of these are decreased if you maintain a moderate level of physical activity. Cancer is also significantly impacted as well by being physically fit. And again, every dimension of life with cancer is impacted in this way. You have a decreased risk of developing many types of cancers. If you survive cancer, you have a decreased risk of recurrence and a decreased risk of death from the disease. And while you're living with cancer, you have reduced cancer fatigue if you maintain some degree of physical fitness. And again, these associations persist even after you correct for body weight. Now, diabetes mellitus is exceedingly common. It affects at least 21 million Americans, which accounts for about 7%, believe it or not, of our population. And most of these patients have type 2 diabetes. It's a cascade where a patient without diabetes might have normal glucose metabolism. Then a patient develops diabetes because their glucose metabolism is impaired. And then those patients can go on to develop other diseases and cardiovascular disease. And when you look at the impact of physical activity, it impacts every step of this cascade. So it can have a profound impact on the life of a patient with diabetes, and it can minimize the complications that we see in these individuals. Now, the reason most people participate in physical fitness is in order to maintain weight. But the truth is, weight loss with physical activity alone is actually quite small. And the activity required to maintain weight loss that you've already achieved is higher than many people realize. So actually the best plan, if weight management is your goal, is not just physical activity, but also modification of diet. The combination is far more powerful in this regard. When we look at a patient's lifespan, the likelihood that an individual will experience some sort of mental health disorder is exceedingly common, whether it be anxiety, mood disorder, including depression, sleep disturbance, or substance abuse. And again, when we look at the impact of physical activity on the development of anxiety and depression, for example, patients are less likely to develop these conditions. The conditions are likely to be less severe in a physically active individual. They'll have fewer symptoms as they navigate the disease, and there's a dose-dependent impact. A little bit of physical activity is helpful, but a moderate amount of physical activity is more powerful. And when you compare physical activity to the impact of taking medications for these conditions, in a certain study, the impact was similar. So a quite important part of treatment, actually. With neurological diseases, there's been a lot of attention in the literature to avoiding the development of Alzheimer's disease and treating it once it's occurred. Physical fitness has a role here. The extracellular amyloid plaques that occur in patients with Alzheimer's are decreased in those individuals that are physically active. Most studies do demonstrate a protective effect of exercise in preventing Alzheimer's disease to begin with. And in those patients that are living with Alzheimer's disease, they can demonstrate improved cognitive performance if they have some degree of exercise in their lives. With Parkinson's disease, which is a neuromotor condition, patients living with Parkinson's can have improved mobility, speed, and other symptoms which can positively impact their ability to live with the condition and maintain independence with the condition. Many people will ask if it's safe and appropriate to exercise if they have chronic pain or a chronic pain condition, and the answer is absolutely and universally yes. There's actually no evidence that exercise causes harm or should be avoided in chronic pain conditions. In fact, on the other side of the coin, inactivity can worsen chronic pain and back pain. Studies have demonstrated that physical activity is effective in the treatment of back pain and effective in many pain conditions, including fibromyalgia. Patients with fibromyalgia have less pain, less tenderness, improved strength, and overall function if they incorporate a certain amount of activity in their lives. Now, bone health is exceedingly important. The development of osteopenia or osteoporosis, particularly in our older female patients, is almost ubiquitous, and physical activity has a role in avoiding this problem. There are 4 mechanisms to the beneficial effect of physical activity on bone health. First, as our patients mature at younger ages, there's increased bone mineral deposition in those patients that perform weight-bearing exercise. As our patients age, there's decreased rate of bone mineral loss with active individuals, which is the cause of osteoporosis, and therefore bone strength is enhanced. And also, because these patients are stronger and have better balance, they are less likely to fall, which is a common cause for fragility fractures. We talked a little bit about muscle health. I mentioned the term sarcopenia. This term, again, refers to a decline in skeletal muscle mass. It's an age-related phenomenon. By the age of 80, the incidence of sarcopenia increases by 50%. And this leads to loss of strength, power, and aerobic capacity. So it can be an important source of disability in our patients. Again, in patients that are physically active, this exercise can increase muscle mass and avoid sarcopenia. It can therefore improve function, which can be impaired in our older patients. It improves balance and, again, significantly decreases the risk of injurious falls and fall-related fractures. And the impact is most powerful in our patients older than the age of 85 and in postmenopausal women. So before we go any further, how can we remain safe as we start to think about incorporating exercise in our day-to-day lives? Number one, choose your activities wisely, and we'll talk a little bit about this. Moderate the total dose of physical activity, particularly as you're just getting started. Combine aerobic exercise with an appropriate amount of strengthening as well. Maintain a normal body weight. The goal shouldn't necessarily simply be to lose weight. Improve your fitness level slowly as your experience level increases, and obtain appropriate care and rehab after an injury occurs. So these are often quoted as barriers to a successful fitness program. No time, no access to equipment, pain and disability, and fear and anxiety about just getting started. But I'm here to propose that these can be overcome. With regard to no time, it's important to pay yourself first. I've tried to demonstrate how powerful physical activity can be in improving your overall health. So pay yourself first and incorporate time for this before dedicating time to other equally important pursuits. No access to equipment. The truth is no equipment necessary. In this era of social distancing and the viral pandemic, avoiding gyms is exceedingly important. But the truth is you don't need a gym or a pool or fancy equipment. Many of these exercises can be done with body weight alone, or at the most TheraBands or 2-pound dumbbells. I've also discussed how an adaptive exercise program can be important and appropriate even in our patients that suffer from chronic pain. And with regard to fear and anxiety, programs such as this can help you learn how to incorporate these programs safely and appropriately. So what are the keys to success? First, do something you enjoy. It's not sustainable if it is perceived as work. Find a partner, even a remote partner, for accountability and motivation and support. Keep a regular schedule. I talk to my younger athletes about how important habits, rituals, and routines are. And the regular schedule allows the habits to become ingrained more easily, and it's much more easy to execute. We'll talk about SMART goals. Reward yourself when you achieve your goals. Positive reinforcement is exceedingly important. And use online applications and fitness trackers to maintain your progress. So what are SMART goals? Well, SMART goals are those that are specific. You want to make sure that you define these goals at the outset. Make sure they're measurable, whether it be through a fitness tracker or an exercise application. Make sure they're achievable. Bite off small chunks. It can be imposing or overwhelming to establish goals that are not achievable. Make sure they're relevant to your specific lifestyle. I often talk to my patients about establishing a routine that is unique to you. Our young competitive athletes will have different goals than our 40 or 50-year-old triathlete, than our 70 or 80-year-old patient who wants to be fit in terms of aging well. And make sure these goals are time-bound so that you can measure them, achieve them, and then establish new goals for the next cycle. Now, how do we operationalize this? What does it mean to be physically fit with a moderate level of intensity? Well, there are a variety of ways to measure this, and I'll go through these three. First is the most subjective, which is the Borg scale of perceived exertion, and it basically is a number scale based on how much exertion you perceive yourself experiencing. The least is from a 6 to an 11. It's how you feel lying in bed or sitting in a chair. A moderate level of intensity is from 12 to 16. It's how you feel with an average level of exercise or activity. And a level of 17 to 20 is how you feel during the hardest work you've ever done. And you really want to avoid this vigorous level of activity, and you want to stay in the green zone from 12 to 16. If you like something a little bit more objective, then heart rate is an easy one to use. You want to maintain an exercise somewhere between 50 and 70% of your maximum heart rate. You can estimate your maximum heart rate by subtracting your age from 220. So 220 minus your age will equal your maximum heart rate. So for a 50-year-old individual, their maximum heart rate would be 170. And then you would calculate 50 to 70% of that as your maximum heart rate. And you can monitor your heart rate with a heart rate monitor that you wear around your chest, or with a smartwatch or fitness tracker around your wrist, which is admittedly a little bit less accurate, but absolutely appropriate for our average patient. METs are a little bit more scientific. It refers to your metabolic energy expenditures. All you really need to know about this is a bit of a frame of reference. So if you look at these numbers that have been attributed to certain activities, it can give you a sense of how to use METs. So an introductory Pilates class has a MET value of 3.5. Swimming, crawl stroke has a MET value of 8.0. And running at a 9-minute per mile pace has a MET value of 11.0. Here's a bit more of an extensive chart with some other activities. So again, your minimum activities, sitting or watching television, is a MET value of 1. Walking at 3 miles an hour is a MET value of 3.3. And jogging has a MET value of 7.0 as a frame of reference. Well, what are the guidelines? Once you know what moderate level physical activity is, how much should you be executing on a day-to-day or weekly basis? The American Heart Association and the American Stroke Association have offered guidelines that are similar to those offered by the World Health Organization, and here they are. So you should have at least 30 minutes of moderate intensity aerobic activity, at least 5 days per week, for a total of 150 minutes per week. Alternatively, if you enjoy vigorous activity instead or have fewer days to dedicate to exercise, 25 minutes of vigorous activity 3 days per week, for a total amount of 75 minutes of vigorous activity per week. And this should be supplemented with 2 days per week of moderate intensity strengthening for about 30 minutes each session. Well, where do I start? We've talked about METs and we've talked about heart rate. Let's just sort of simplify it a little bit. So here are some activities that you may already participate in. In terms of the moderate category, which is our goal for most patients, walking at 3 miles an hour, water aerobics, cycling at less than 10 miles an hour, doubles tennis and ballroom dancing, and gardening are all considered moderate activity, moderate intensity activities. There are some vigorous activities as well. As I said, jogging and running are in that category. Fast cycling for our more strenuous athletes watching the talk tonight. Jumping rope and hiking uphill or with a heavy backpack are all considered vigorous. Now, I've talked about the importance of maintaining a certain amount of strengthening as well. You want to have at least 2 days of strengthening, 30 minutes each. Now, how do we incorporate this? Well, you want to keep the weight down and the repetitions up, with a goal primarily of conditioning our muscles. In our younger athletes and our collision athletes, for example, that are trying to generate power and trying to improve their strength, they're going to increase weight and decrease reps. But for our average older individual just getting started, you want to minimize your weight and maximize reps. So 10 to 15 repetitions in our older patients that are just starting to exercise. With regard to technique, you want to be controlled with these exercises, and you want to be able to complete these repetitions, at least for the first set, quite easily. So 3 seconds to lift the weight, 1 second to maintain the weight at the end range, and then 3 seconds to return the rate to the starting position. Exhale with exertion and don't hold your breath, and use smooth, steady movements. If you're having to thrust the weight up and down, it's too much weight and you're not really getting much out of it, and you are more likely to get injured. So in summary, aging well begins with smart lifestyle choices with respect to diet, alcohol, and nicotine usage. Physical fitness has a positive impact on a variety of health conditions, including mortality, cardiovascular disease, diabetes, mental and neurological health, and musculoskeletal health. It's important for each individual to know themselves and to identify barriers to success and keys to success in order to help yourself succeed. Establish SMART goals. And as you get started, you want to aim for a goal of 150 minutes of moderate intensity physical activity per week and 30 minutes times 2 of strengthening per week if you can. Thank you very much for your time tonight. There will be a recording of this presentation on our website at onsmd.com/webinars. If there's another topic you'd like to learn about, email us at contact@onsmd.com, and we look forward to seeing you for the next webinar. Great. Well, thanks everybody for hanging in there. I'm going to take some questions now. So we have one question ready to go. Feel free to type anything. Any question is welcome for sure. And I think this is oftentimes where our participants get the most out of these discussions. So there's a patient on the webinar tonight who's 61. They've been a runner for most of their adult life. Their heart rate during running can get as high as 170 beats per minute during a 3 to 5 mile run. Should I stop running because my heart rate is too high for my age? It's a great question, and I think this raises the point that there really is no one right answer for everyone. A lot is going to depend on your level of experience, and a lot is going to depend on other health conditions that you may have. So we find that what's unique about patients that are already in the expert category of running is that they can tolerate a higher heart rate during their activity, and their resting heart rate often drops much lower. Their resting heart rate can often be as low as 40 or 50 when a normal resting heart rate is somewhere between 60 and 80. So there's no one right answer. And I think that if you are a healthy individual with no other comorbidities and a heart rate of 170 can be acceptable. But if you're exceeding your maximum heart rate as defined by 220 minus your age, you should consult with your primary care physician. Make sure you have a wellness visit each year, and make sure that your primary care physician is aware of your maximum heart rate while you exercise and that they give their approval for it. They're going to listen to your heart and lungs. They're going to likely get an EKG as a part of your wellness visit and make sure that there are no other health problems they need to be aware of, like an irregular heartbeat or an arrhythmia. I'll give a few minutes to wait for some additional questions. Another audience member has asked what type of equipment they should have or use as a part of their strengthening program. And I think that, again, no right answer. It's going to depend a lot on your level of experience. I think the one good thing about certain machines that are available in the gym is that, number one, they give you some instructions. Number two, they restrict your form, so they keep you on a certain track without letting you get off track the way barbells and dumbbells can do. And those things can be advantageous. I think on the other hand, I think sometimes patients dabble in machines without establishing specific goals for themselves, and I think that's where sometimes a program can go awry. So what I often recommend to patients that are in a gym setting and considering using machines is work with a trainer at least once. Many gyms across the spectrum of quality and cost have access to personal trainers. And I think it's helpful to work with a personal trainer at least once to educate yourself about these various machines, how the machines can fit into your specific set of goals, and how to use them properly. Because the truth is, as I've mentioned, sometimes machines are more trouble than they're worth, and they may not fit into your program. 2-pound weights and TheraBands are often much more helpful, and body weight exercises are often enough. Another question just came in. I engage in chair yoga 3 hours per week, including standing stretches. Do you consider this part of the 150 minutes per week? Great question. It can be a part of your 150 minutes depending on your age and maximum heart rate and what your goals are. If you're on the younger side, chair yoga may not provide the aerobic activity that you need. So for our younger patient, and let's say in the 60 to 90 range, chair yoga would be supplemental. But in our older patient in the 75 to 90 range, I think it can absolutely be a part of your 150 minutes, as long as chair yoga is allowing you to increase your heart rate somewhat. If it's not increasing your heart rate, then to me, it's more part of a stretching program, which is supplemental to moderate intensity physical activity. Okay, our third question came in, and it has to do with steps. I think we all can relate to the sort of feverish counting of steps with how ubiquitous fitness trackers have become. Does 10,000 steps a day really provide a benefit? Great question, and I think the answer is yes, primarily in contrast to the sedentary lifestyle we all typically lead. I think without steps and without fitness trackers, I think we all sort of fall into a relatively sedentary pattern of sitting at our desks, using elevators, driving from place to place. And I think what a 10,000 step sort of motivation does for us is it forces us to ask the question, should I take the stairs? Should I walk to get the mail? Should I take the dog for that additional walk that they may not need? And therefore we get that incremental extra activity that we wouldn't have already gotten. So yes, I think 10,000 steps do provide a benefit. It forces us to get the physical activity that we aren't probably getting in our day-to-day lives. I think to me, it's a stepping stone towards the 150 minutes rule. For those patients that haven't yet formalized their 150 minutes of moderate intensity physical activity, 10,000 steps can be their first foray into an active lifestyle. Once you are getting your 10,000 steps regularly and you're confident and it's become a habit, a ritual, a routine, now it's time to take that next step toward 150 minutes. And once you get those 150 minutes going, and now it's a habit, then it's time to step into 2 days a week of strengthening. And then once you get your strengthening and your 150 minutes, then perhaps you add in 1 session of vigorous activity, and on it goes. So your goals start very simple and they evolve over time as you become more experienced. I think 10,000 steps is the very first milestone. Are there any additional risks if you have treated high blood pressure for moderate to vigorous physical exercise? I think the short answer is there's a theoretical risk if you have treated high blood pressure, but it is far outweighed by the benefit. You know, in medicine, when we interact with each and every patient during our work every day, we are always weighing risks and benefits of every intervention, because the truth is everything has a risk and a benefit. And we calculate both, and the option that maximizes benefit and minimizes risk is the chosen option for that patient. And the benefit of moderate intensity physical exercise for our patient with treated high blood pressure is so far greater than the theoretical risk that it's recommended. Obviously, after consultation with your primary care physician who's treating you for high blood pressure, but I can almost guarantee that they'll agree with me that the benefit is worthwhile. I would just be very careful about how you institute the program and how you advance the program. Back to chair yoga, do you recommend taking a heart rate before and after your exercise? Well, I think this isn't unique to chair yoga. I think it's applicable to every audience member who is either already physically fit or thinking about getting started. It reminds me of when I talk to my young athletes about diet, hydration, and supplementation, a lot of things that they care about in order to gain a competitive edge. When I'm talking about my young athletes who are thinking about how to hydrate appropriately, I tell them initially, just to get to know their own body, to weigh themselves before they participate in a practice or game and after. And that's the only real way they'll know how much they sweat and how much water weight they lose over the course of a practice. And then with that knowledge, they can calculate how they should be managing hydration and water intake during a given period of exercise. And the same thing holds true for heart rate in our less experienced patients. Measuring your heart rate can be exceedingly valuable to give yourself a sense of how much you are exerting yourself during an episode of exercise, because it's not intuitive and not everybody has a good sense of it. So yes, measuring your heart rate is exceedingly valuable to understand how much you're exerting yourself, how much aerobic exercise you're getting during a session of chair yoga, or walking at 3 miles an hour, or walking your dog, or cycling, or jogging, and the list goes on and on. So I absolutely recommend that you use a fitness tracker or a smartwatch or a heart rate monitor, or just take your pulse with a normal watch with a seconds hand and calculate your heart rate before you exercise, calculate your heart rate afterwards, and get a sense of how you're doing. It'll help you gauge whether you're getting enough exercise and what you can do to modify your program. This is something that'll have to be done periodically as you go, because as you become more experienced, you're going to tolerate more exercise and be able to maintain your heart rate at a given level. So measure it periodically as your level of experience evolves. Great. Well, thank you very much. And thanks for the great questions that I think benefited everyone in the audience. I really appreciate you staying tuned. And again, keep in touch with us about topics that are of interest to you. And you can visit our website for this webinar on video and other webinars that have been given in the past. Take care, everyone. Bye-bye.